Hi, I'm Ruth Regan, Chair of Medicine at the University of Rochester. So next generation sequencing is just a way of assessing the expression of hundreds of genes in an individual tumor just in a very rapid manner. So the reason it's important is because we know that cancers are driven by genes. And if we can find out what genes are driving an individual patient's cancer, then we can potentially have a treatment that will target those genes. So there's plenty of examples of that currently ongoing in terms of therapies. So basically what we do is when a patient's diagnosed, usually with metastatic cancer, we'll send off a piece of their cancer for this next generation sequencing. And what comes back is results that show if there are genes that are mutated or essentially that are driving the cancer. And sometimes that can allow us to make treatment choices for patients. So to give you an example, so in breast cancer, there's a gene called PI3 kinase, which is very important in driving cancer cells growth. And it's mutated in about 40% of estrogen receptor positive breast cancers, which is a specific type of breast cancer. And we now have a drug called alpelisib that actually targets cancers that have this PI3 kinase gene present and mutated. So we only give that drug to patients who have this particular mutation in this gene. So that's an example of where next generation sequencing would be very useful. Now, for other cancer types, it can also tell you, for example, whether a cancer might be likely to benefit from an immune therapy. So patients with lung cancer tend to have it sent off very often, but more and more we're sending it off on basically all types of cancers, and because of the information it can give us. So you should certainly ask your oncologist if that might be an option for you.